Hey, it's been a minute. Hope everybody's had a good beginning of their year, had a good holiday season. I took some time off of the chaos just to sit back and observe the world on fire for a minute. But jumping back in, I want to talk about something that I've mentioned before. People have asked me about it, why I say it. So here it is. There's no such thing as Obamacare. All right? How can I say that? How can I say that when you've heard it thousands of times? You see signs out there, you see signs on corners, you see signs on businesses, get your Obamacare here. How can I say something? Here's why I can be so cocky and confident in saying that. The reason is because there's no such thing as Obamacare. Want to dig into it? Let's dig into it. To be redundant, a bill was passed. A bill was presented in 2009, 2010, H.R. 3590. That was the bill that then became the law that Barack Obama signed in 2010. And that law became 111 something, 111, 148. Not that that matters, but just trying to run numbers here. What's funny is right after it was signed, right afterwards, they changed it. Government. They changed it to H.R. 4872 was the number that they changed it to. Then, in true government fashion, they had to put a name on it. So they called it the Patient Protection and Affordable Care Act. Doesn't that sound fuzzy? It sounds warm. You want to just cuddle up with it, doesn't it? Patient Protection and Affordable Care Act. Who wouldn't want the Patient Protection and Affordable Care Act? But then in true government fashion, they're too stupid to remember words, so they have to abbreviate everything. So then it became the PPACA. And then, of course, the entire world is too ADD and short attention span, so they had to drop it to the ACA, Affordable Care Act. That's kind of what everybody calls it. Now, somewhere along the line during this, somebody threw in Obamacare because Barack Obama was president. He's the one who signed it. He wanted to do something with it, even though he didn't write any of it. But that's typical. None of the presidents do. They just sign it. So it became Obamacare, and not even probably, that was derived because of previous administrations, and then people like Mitt Romney, governor of Massachusetts, had a version of it that somebody labeled Romney Care. So they just take whoever's name is on it and throw it onto whatever law is being passed. And the ACA, as we know it, was derived in part because of what Romney Care was. So anyway, it's a marketed term that was thrown out there that represents the law that was passed. But there's no such thing as Obamacare. Now, I have clients come to me quite often, and they're looking for results. They're looking for some help, some kind of a salvation in this ugly mess that we're in right now. And many of them will say, okay, but I don't want anything to do with this Obamacare because I hear that's a total disaster. So first thing I do is tell them that there's no such thing as Obamacare, very politely, and then I go into my spiel of why. In their defense, they are innocent in their ignorance by definition, because they've been fed a line of bullshit this whole time. It's not their fault. This is what they've been told. This is the signs they see. This is the stuff they see on the news and hear from our own government. Obamacare, Obamacare, Obamacare. So many people are under the impression that Obamacare is some sort of a health care plan that you can sign up for. It's not. It's just simply false. It doesn't exist. There's no such thing. What it is, the term Obamacare we've determined is a marketed term. The ACA in the law is something that built a environment that insurance companies could go to and participate in. Now, what benefit do they have of that? Well, the government's going to be behind them. So why not? It's good for business. It's more business. It's making a partnership with the United States government. So they want to play in the sandbox that is the ACA. They have to follow a bunch of rules. The rules were laid out in this bill that became a law. Side note on it, the law itself had 906 pages. 906 pages. Think of the longest novels you've read. 906 pages to make this law. The rules and regulations that created everything to make the law were over 11,000 pages. There are statements out there that say that it's gone as high as like 20,000. I don't know about that, but I do know it was at least 11,000 pages of crap. You wonder if there's waste and abuse in our government system. I diverge. So, getting back to it. So these people, many of them clients, are looking for something, and they're under the impression that that Obamacare is some type of health insurance plan, and it's not. Let's look at the wording and the terminology. First of all, Obamacare. We know the name, Obama. He signed it, so they labeled it with him. The word care has nothing to do with what this law is. Nothing. There is nothing caring in this. Go to the actual term that they labeled the law with. Patient Protection and Affordable Care Act. Patient protection, maybe. I give credit where credit's due, and there were a couple things that were put into place that needed to be done. I'll say this 1,000 times, and you'll hear it redundantly say it if you follow me and watch me. But what they tried to do was eat an elephant in one bite. And when they came out, they were chest thumping and saying, look what we did. And what they did was build a pile of shit. So their intentions may have been good. I don't know. I can't get in their own heads. But what they did was not, because patient protection, again, maybe some of that is true. One thing they did, and I will say, like I said, I give credit where credit's due. They said that if you want to play in the sandbox, you're an insurance company, you want to come in and play in the sandbox and offer up insurance in this environment that we've built for people to come in and purchase insurance for or get tax subsidies for, you have to do a certain number of things. That's part of the law. One of those things is you cannot deny anybody or rate them, charge them higher based on their health. That's a good thing. There are people who are self-inflicting all sorts of garbage to themselves every day, whatever. That is what it is. It's their own health. But man, you're born as a type 1 diabetic and you got to deal with that your whole life. Is that your fault? Is that something that you should be denied? Is that something that an insurance company goes, nah, we're not going to insure you? You can argue the free market capitalist crap all you want, but that's bullshit. Nobody, I mean, there are people with all sorts of problems and you can't get insurance because of it. I digress again. I will get back into those things much, much more later on. But let's go back to it. So, if you have that in place, you're going to have financial problems going along with those insurance companies because they have to insure people who are going to cost them a lot of money. That's the whole Achilles heel of this thing. Now, there were things put into place, like every American had to buy health insurance or they would be penalized at tax time. The reason that was there is because of the monetary aspect of it, because they needed to fund this thing so that they could cover everybody. Not a horrible, horrible thought process, but to force somebody to buy something is, there's constitutional issues involved in that. So that was a little bit ugly too. But back to the name, Patient Protection Affordable Care Act. Again, care shouldn't be in the word because what this is about is health insurance. And insurance and care have nothing to do with each other. Insurance is about power and money. That's what it's about. Maybe control. Control and money. Control, which equals power. Control and money is what insurance is about. Care, healthcare, is what healthcare providers provide to you. The doctors, the nurses, ambulance drivers, paramedics, interns, nurse practitioners, the lady or man at the front desk telling you where to go when you walk into a hospital or a doctor's office is providing more care for you than anything to do with insurance. Insurance decides what they're going to pay for things, how much you're going to pay them, and whether or not they're going to cover you when you need help. That's control. They're the ones running the whole thing. Okay, so again, no such thing as Obamacare. That's the one that I go off on tangents because there's so much to talk about. 906 pages in this law. But remember, the next time you're driving on the street and you see a sign that says Obamacare here, get your Obamacare, time for Obamacare. If you got a minute and you want to entertain yourself, go on in and say, I want to get me some Obamacare. And then they're going to sit down with you and they're going to ask you all sorts of questions. They're going to put you through the ringer. And at the end, they may present you with an insurance option, a couple different options to look at. And those options are going to be from companies that you've probably heard of. Some of them might be huge companies. We all know them. I won't mention them here. Some might be small companies, but they're going to present you with these options. And then you look at it and say, well, no, I want Obamacare. And they're going to look at you like you're dumb and go, well, this is Obamacare. I say, no, but where does it say Obamacare? And then they'll tell you there's no such thing. And then you can say, okay, well, thanks for your time and walk out. Now, are those people bad people? No, I'm not saying that, but they're not being honest. Just like the government was not being honest with any of us when they tried to sell this bullshit back in 2010. I think in the greatest country in the world that we deserve a little more honesty, a little more transparency from our leadership when they're making decisions that affect every one of our well-being. Don't you? Listen, if you want to join part of this, if you want to get into this with me a little bit, if any of this interests you, it's a boring topic, man. Insurance is not exciting stuff. But if you found out anything you didn't know, or you want to know more and you just want to join in on this, please follow and like this, share this with people. Let's get some people involved and start interacting, because social media is good for one thing, and that's getting fires started. So let's maybe try it, all right? Follow and like, and I'll be back. Thanks for watching.